Yes, and 101.1 FM. Good morning to you. You know, each month we get to talk to somebody from the Indiana Regional Medical Center about health in some arena or another, and this is Men's Health Month. We want to talk about heart health specifically today with Melissa Duncan, who joins us this morning. Good morning.
Good morning, Todd. How are you today?
Wonderful. It's good to have you back with us.
Thanks.
Men's heart health. Why should I be concerned about that? I'm young, I'm healthy, and I shouldn't have to worry about that. Should I, Melissa?
I hear that all the time, and those are the people who usually get in trouble because they're not doing the things to, prevent heart problems, prevent disease in general. Mm-hmm. But, really getting ahead of things, staying healthy early is so important.
Well, see, that I bet you would be the hardest thing to convince guys of.
Totally.
Yeah. Right now, no matter what stage you are in life, you need to start thinking about what's going to be coming 20, 25, 30 years down the road.
Everyone's busy. They don't want to think about those extra things, those extra steps to really protect your heart, protect your health, protect your family from, crisis later.
Mm-hmm. We should tell folks that Melissa is a physician's assistant with Doctors McDowell, Metzger, and Gregg.
You got it. Yes.
There you go. So this program that we've been talking about here the last couple of days, the Wild Heart, that's a part of what you're talking about, isn't it?
At IRMC, it's June, it's Father's Day, so we're really focusing on our dads and grandfathers this month. And so, we, through the Wellness Center, we've been developing some programs. And this month, it's the Wild Heart, which is a men's health program for our fishermen and hunters out there. It's over at the Triple Nickel Park, free for anyone who wants to attend. Yeah. I think you've been putting out the phone number to sign up for that.
357-8088.
Yeah, 6 p.m. on June 21st. So we encourage, guys to get out there and hear a little bit about how, doing the things you love, hunting and fishing, can really help protect your heart for the future.
Mm-hmm. All right. So what are some of the things? Let's divide it up. And I know this is simplifying it way too much, but let's divide it up by guys who are in their, say, mid-20s to about 40 years of age. What are some of the things they should be thinking about in terms of their heart health right now?
At that time, looking at those habits, your diet habits, are you a smoker? Those are things that you really need to start changing early. Or not starting. If you're not a smoker, don't start. But really, those are the things that make the biggest difference early on.
Okay.
So at that age group, totally diet and smoking.
All right. And as you then age past the age of 40 and you're getting toward 50, should you begin to focus on other things?
Yeah, I think at that point, people start to slow down a little bit. Those joint pains and aches start to set in, and we slow down, and staying active is so important. The Wellness Center offers, services there, and that's the age group that we really cater to. We want those people to stay moving. We're not asking you to be a marathon runner. We just want you to stay moving.
Now, with the office with which you're affiliated, people generally already have some heart concern when they come to visit you, correct?
Correct. Yeah. So we're seeing a lot of patients now who've been cared for by our PCI, our cardiac catheterization program that opened in November over at IRMC, and we're really excited about that. We've cared for over 200 patients there so far since November, and I think about 60 to 70% of those have been men. So, we're taking care of patients right here in our community, and that's been a huge thing for both IRMC and Indiana County.
Now, not that I don't want you folks to have plenty to do, but there are things that people can do to maybe forestall having to go to visit a cardiologist.
Yeah.
And that's with the lifestyle choices that we talk about.
We don't get offended. We don't want people to have to come and see us.
But what about the point at which you begin to think, okay, I need to be starting to get this tested or that tested, have this monitored in your lifetime, even if you haven't had any symptoms of any heart problem?
Right. I think the first stop is your primary care physician. They're the ones who you can really sit down with and talk to and say, okay, this is going on. Do I need to worry about this? What's the next step? And they can really guide you through that process and decide if a trip to a cardiologist is appropriate.
You're thinking about cholesterol levels at some point and those sorts of testing?
Yeah, there's standards that are out there for when cholesterol levels should be started to be tested, and things affect that, family history, that sort of thing. So again, your primary care physician is aware of all of those things and can really walk you through that step by step.
All right. So when you began, you said dads and then you said granddads. So as we get older in life, and some of the granddad issues have to do with the heart, what are they?
Well, as we age, heart issues become more prevalent. So we're seeing increased risks of coronary disease and cardiac arrhythmias as we hit those grandfather years. So, a lot of our patients are 60 or older. So we see a lot of granddads in our practice.
People who generally you deal with
Yes.
are people who have had some heart issue or such in the past or are currently experiencing some. But a heart issue isn't necessarily a death sentence. I think people, when they hear, okay, you've got a bit of a heart problem here, they might say to themselves, that scares me to death. It doesn't need to, does it?
It doesn't. People are often surprised after a heart attack and they come back to our office. The very first thing we start talking about is cardiac rehab. It's getting them back into the swing of things, getting them back walking and doing things, getting them back into their garden. That's been a huge question I've been getting in the office. Can I go out and work in my garden? Can I use my lawnmower? And the answer is yes. And we want people to be doing the things that they love to do. And, we're committed to getting them back to doing that.
All right. So getting them back to a somewhat semblance of a normal life is a key thing that you do.
Correct.
What are some of the steps that people might go through in a heart rehab program?
We start out by just walking, getting them on a treadmill, and getting them moving. So much about cardiac rehab is teaching limits. You now have this new diagnosis. What are your limits? How far can you push things? So cardiac rehab is set up with a nursing team who's watching you and encouraging you and helping you to learn those new limits and whatever they may be.
And you mentioned earlier diet. That has to be a whole part of the equation, too.
Correct. We have a nutrition counselor who's involved in that entire program, sitting down with not just the patient, but the patient and their family, talking about what your current diet is and what changes need to be made.
We also hear a lot about heart function. This portion of your percentage of your heart is functioning normally. This section of your heart needs a little bit of extra help here or there. Technologically, I would assume that there are always advancements in making the heart work more efficiently and better. But there probably are some pretty traditional things that can be done as well.
Yeah, I mean, the standard of care is really medications, decreasing the stress on the heart and keeping it functioning. Decreasing blood pressure is paramount, making sure that your blood pressure isn't too high, because if that's the case, your heart's working too hard. And then that function is decreasing. So, there's a lot of advancements, but some things stay the same.
And it's not just the heart chamber itself or the heart muscle itself. It's
the heart muscle and the arteries and the valves. It's pretty complicated when you start delving into all the details. But yes.
When we hear, I should say, you're right there in the middle of it, but when we hear about advancements, including stent technology, bypass, of course, has been around for decades. So has stent, for that matter.
Yeah.
But
stenting has, come light years in just the past
that was what I was going
2
to
years.
ask.
More and more people are receiving stents that would have previously had to go to bypass surgery. And these stents are saving their life. We have patients who come in the setting of an acute heart attack, and from the time they show up in our door at the emergency department, they're on the cath table and have a stent placed in an artery that saves their life in about 45 minutes.
Wow.
That turnaround time is better than 90% of the rest of the nation.
Wow.
Which is pretty amazing, and we're really excited about over at IRMC. But these stents hold those arteries open and get that blood flow back to the heart muscle and stay there and stay open and really get that patient back to their families and back to functioning.
Does the heart recover quickly once the blood flow is restored, or is all of the damage done to the heart irreversible damage?
Not always, and that's why we focus on that time, because the faster you get that artery open, the greater the likelihood that muscle is saved. So that time is so important. You'll hear us talk about it over in the cardiology department over and over again. I think some people probably get sick of us hearing or sick of us talking about that time, but it's so important because time is muscle. And so the faster we're getting you into the cath lab and getting those arteries open, the less likely you're going to have permanent damage to that heart muscle.
Melissa Duncan is with us this morning. We're talking about heart health, particularly for guys in this Men's Health Month. Are guys, because you deal with men and women, are guys more stubborn about making lifestyle changes? And you can be honest with me.
I get that question a lot. I don't know. I think they're probably more stubborn, but I think usually their wives win. At least in some cases. But, people don't want to admit that they're getting older. People don't want to admit that things are changing. So, men, women, we all kind of are wired somewhat similarly in that regard. But yeah, we've got some stubborn dads out there.
Last minute with Melissa Duncan. All right. 2 things or 3 that guys need to do now to make sure that their heart is where it needs to be.
Ooh. Get an annual physical exam with your primary care physician.
Starting at what age?
You're going to get 20 different answers if you ask 20 different providers, but I'd say start early. Start in your 20s.
Okay.
Get that relationship started.
Okay. That's the one
I think
thing.
that's number 1. And then number 2, be aware of your body. If you start seeing changes that just don't make sense, I'm not able to do the things I was doing 1 month ago, you really need to reach out and touch base with someone who can help guide you to the next step.
There you go. It all starts with your primary care physician, then,
Yes.
doesn't it? Beautiful. Thank you, Melissa.
Thanks,
we
Todd.
appreciate it.
Always good to see you.
It is Indiana in the Morning, presented by First Commonwealth Bank, and it's AM 1160 WCCS 101.1 FM.